Hi, my name is Ryan. I'm an assistant at DLEAH. This is Lucy, also an assistant here. And this is Spooky, our volunteer cat today. We're going to be doing a demonstration of some basic cat handling techniques. So we're going to start with doing a front leg hold. So you'll see, bless you. Lucy has a C grip under Spooky's jaw. She's holding the points of Spooky's jaw here and here, but she's not putting any pressure on Spooky's actual neck. She's got a hand wrapped behind Spooky's elbow and with her thumb over the top so that she can roll the vein over. And so then I can either place a catheter here or get a blood draw in this front leg. You'll notice she's also got Spooky backed up against her body so that Spooky cannot back up off the table. So next I can help, just flip Miss Spooky over under her side here. Lucy has got her arm over her neck here, so she's pinning her down on the table on the side of her neck. This prevents Miss Spooky from dropping her chin down and getting any kind of bite or attack on Lucy. She's got her front paws held with one hand, hi miss, with her finger between, and then her back paw is held the same way. If we wanted to do a back leg draw, I can take this bottom leg. Lucy can do a sort of karate chop across the bottom leg to help raise this vein up. I can hold on to the paw here, and then I can do a blood draw right here. All right, so next hold would be for a jugular draw. So again, Lucy has Spooky backed up against her body so that she can't wiggle off the table. She's got her points of her jaw held with the C grip again around the back of the head. She's got her legs held here with a finger between the legs so they aren't grinding against each other. And then I can take off her collar, and I can hold off here to get a jugular draw. So obviously Miss Spooky is pretty relaxed with us, but if she were to get a bit more wrestly, we can also do towel wraps. We like to use Sophia Yin's methods here. You can find her on YouTube or kind of all over the internet. She has a lot of great demonstration and techniques regarding different kinds of towel wraps you can use in your clinic. So to start a Purrito method for a front leg, lay your cat down on the towel. Again, Lucy is right behind her, so she can't back up. If we're using this leg, we can cover over this leg. I can help distract the cat while Lucy wraps her up. Hold onto this paw so she can't pull it back. And then again, Lucy has her head contained. She's got this nice C grip on the points of the jaw, but not restraining the neck at all, or not pressing on the neck at all. We've got this paw held out, so I can do a blood draw, I can place a catheter, and Lucy again has this vein rolled off right here. All right, so we can do a modified version of the towel wrap for a back leg draw. So in this case, Lucy is containing her front legs in the towel. She's got her head partially wrapped, and then she's got that grip over the neck again, so she's pressing the side of Spooky's neck down onto the table, but there's no pressure on the front of her neck. We've got these paws contained in the towel, and then she's got this karate chop grip on the back of the leg, raising this vein up here and allowing me to do a blood draw back here without me having to worry about Spooky's front legs or her head getting at me. So Spooky here is obviously very relaxed and very easy to work with. We're in a quiet environment, which is really helpful. We're also in a contained environment, so if she were to escalate, we can always step back. If she were to jump off the table, we know that she's contained in the room and she can't escape from us. Which gives us the ability to reset and regroup safely if we needed to. If you have a cat that is escalating, you can always talk to your doctor about sedation, about other options as well for safe handling. There are other tools we can use, like a cat mask, for example. Some clinics have a cat bag. We use scruffing here very lightly at Dove. It's a little bit of a controversial subject. Some people are taught that you should always scruff. Other people are taught that you should never scruff. My personal philosophy is it can be a useful tool in the right circumstances. If you are going to scruff, you want to make sure that you're doing it properly. So you're going to want to make sure that you're doing it high up on the head, like this, so that you're not putting undue pressure on the neck. If you have some cats that will escalate with scruffing and will get more aggressive, so that's an instance where you need to back off and talk with your doctor about a safer approach. And that is how we do low-stress cat handling at DLEAH.